Educare.
Gastroesophageal reflux. How to identify and treat it. Disease or natural phenomenon. Within certain limits, gastroesophageal reflux is a completely natural phenomenon and can happen at any age. It is considered an illness when gastric acid reaches the esophagus in unusual amounts, and it should be treated to prevent the esophageal mucus from becoming inflamed and possibly worsening. In children, treatment can minimize negative effects on their health and growth. But what causes reflux? This is essentially a deficit in the anti-reflex barrier, which is at the cardia area. This deficit causes sudden drops in the cardia's base pressure, which, without peristalsis, allows the gastric content to come into the esophagus in contact with the esophageal mucus. Factors affecting reflux relate to a low-functioning cardia, which can be affected by the type of food eaten, tight clothing, posture, and hormones. Reflux can also be affected by hypothyroidism, which slows peristalsis and all digestive system functions. In infants, signs of reflux may be expressed in high-pitched crying during digestion, or a wet pillow with an acrid smell. The symptoms are always very similar, including reduced appetite, frequent awakenings, significant reduction of growth in weight and height, irritability, loss of vitality and interest in the outside world, breathing problems, and changes in the tone of voice when crying, which grows weak. In both children and adults, reflux may occasionally occur as a psychosomatic disturbance at times of stress, or with specific symptoms, including dental enamel erosion causing cavities, vomit with blood, and anemia from iron deficiency, appearance or worsening of breathing problems like wheezing, sleep apnea, hoarseness, and laryngitis. If infants suffer from occasional regurgitation, but there is no growth slowing or other problems, you can use an anti-regurgitation milk, a double cushion under the infant's head, or an antacid like alginate. If the reflux is moderate, you could add an anti-secretory medication. Older children and adults should follow a diet limiting chocolate, sausages, fatty cheese, processed foods, and soft drinks. They should eat small, frequent meals, not smoke, and avoid physical activity during digestion.